Hi, this is day 2 of chapter 2, and we are continuing to talk about the private healthcare facilities. So there is concierge medicine, and this is a retainer medicine. It's a type of personalized healthcare, and in exchange for an annual or monthly fee, an enhanced level of care is provided by a primary care physician. So your PCP or your primary care physician, that's the doctor you go to on a regular basis for your checkups. The physician is able to care for fewer patients while having more availability. So this is probably more likely for those who are rich and famous, like Michael Jackson. He had his own personal primary care physician, and he was probably on call for Michael Jackson 24 hours a day. And the rates and services vary depending on the probably location and then the services that the doctor provides. Of course, there's dental offices, and they vary in size. In some areas, major retail or department stores operate dental clinics, and they can include general care provided to all age groups or specialized care offered to a certain age group or for certain dental conditions. So I have nephews, they go to a pediatric dentist in the Holland area. It would include an orthodontist, which would be specialized care. You might also have some dental offices that specialize in dentures. There's also clinics or satellite centers, and they are healthcare facilities found in many different types of healthcare fields. And they are composed of a group of medical or dental doctors who share a facility or other personnel. So kind of OMG here in Owasso would be considered a clinic. They can also be private groups to provide special care. Surgical clinics or surgery centers, they perform minor surgical procedures. These procedures can be one-day procedures or outpatient procedures where the patient goes in there, has the procedure, and then they go home after they recover. And this is cheaper doing it in a surgical center than it would be in a hospital. There's also urgent walk-in or emergency care clinics, and they provide first aid or emergency care to ill or injured patients. So sometimes a walk-in clinic or an urgent care can also be a primary care physician office, but they also accept walk-ins or urgent care needs there. Rehabilitation clinics, they offer physical, occupational, speech, and other similar therapies. Here in Owasso, we have the Woodard Station, which is associated with Memorial Healthcare. And then over in the Walmart Plaza, there's also ATI Physical Therapy. And here is a video of an outpatient rehab clinic that's in New York. Just gives you an idea of services that outpatient clinics may provide. Each outpatient clinic will be different. Some specialize in neuro, which are conditions of the brain, strokes, brain injury, or they may specialize in orthopedics, hips and knees surgeries, or injuries or sports injuries. So each outpatient clinic is going to be different. So you can go ahead and watch that YouTube video over in Google Slides, which is in the Google Classroom. There's also substance abuse clinics. They provide rehabilitation for drug and alcohol abuse. And these can be the clinics where the patients will go maybe twice a week, maybe 3 times a week, maybe even every week for counseling for drug and alcohol abuse. In most cases, these also involve family members because the family members play a large role in drug rehab for patients. Specialty clinics, they provide care for specific diseases. It could be a diabetic clinic, a kidney dialysis center, or oncology clinic. Oncology is for cancer. So this gentleman here in the picture, he is in dialysis. Dialysis, what it does is it cleans your blood of the toxins and waste that your kidneys would normally do. So most of the time when patients are on dialysis, they're on there for a lifetime. There are some who go on it for a short term, but it is usually a lifetime process. They have to go 3 times a week, either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. So even if the patient wanted to go on vacation, they will have to find a dialysis clinic that they could go to while they're on vacation. It is a very tiring and exhausting process. They're usually very tired afterwards. And it can take anywhere from 2 to 4 hours while they're there at the clinic. And because their kidneys aren't working, many times they don't urinate very often, maybe once a day, maybe twice, and it's just a small amount because their kidneys are not working, and that's why they have to go to the dialysis, because usually you would urinate out your waste, so in dialysis they have to clean out the waste or the toxins. Outpatient clinics are usually operated by hospitals or large medical groups, and they provide care for outpatients. It could be any number of things. Health department clinics, they may offer clinics for pediatric health care, treatment of sexually transmitted diseases, treatment of respiratory disease, immunizations, and other special services. This is our Shiawassee County Health Department, which is in downtown Corona, close to the courthouse. Parents can take their children there for immunizations. You can go there to get your TB test. And it's also, the health department is also who the schools and Baker College looks to on protocols for COVID-19. Medical center clinics are usually located in colleges and universities. They offer clinics for various health conditions. They can offer care and treatment and provide learning experiences for medical students. So it's where medical students may work at, even student nurses, so they can learn more. Optical centers, they can be individually owned by an ophthalmologist or an optometrist. So what's the difference between an optometrist and an ophthalmologist? That optometrist would be someone you go to for your basic eye exams, and they would prescribe glasses for you. The ophthalmologist is who you would go to if you were to have eye surgery. So an optometrist is not able to perform eye surgery, and ophthalmologist can perform eye surgeries. So if somebody needed cataracts removed, they would go to see an ophthalmologist. Again, they can be part of a large chain of stores, and they provide vision examinations, prescribe eyeglasses or contact lenses, and they check for the presence of eye diseases. Emergency care services, they provide special care for victims of accidents or sudden illness, and it is just not the paramedics and EMTs who work in the ambulance. It also includes services such as, again, like the ambulance, like we said, both private and governmental, rescue squads, which are usually operated by the fire department, emergency care clinics and centers, emergency departments operated by hospitals, and helicopter or airplane emergency services that rapidly transport patients to medical facilities for special care. So emergency care services does cover a lot. Laboratories, they can perform special diagnostic tests such as blood or urine tests. Dental laboratories can prepare dentures and many other devices used to repair or replace teeth. So the laboratories is a bit behind the scenes at the hospitals. It is one of the sites that our students go to for clinicals, which hopefully we can do that this year. I know last year the students really enjoyed the laboratory. And here is a YouTube video to give you an inside look of what a laboratory may look like. Now this is a very large laboratory. It is in New York, and it costs $50 million. So again, we talked about how expensive healthcare is, and the cost of specialized equipment is expensive. And this is proof right here. They talk about it. They also talk about in the video is how they get results quickly. So of course, when a specimen is sent into the laboratory, it's important to get the results quickly. The faster you get the results, the faster doctors can diagnose the condition, and then as a result, they can treat the condition much faster. So it's a pretty interesting video, so be sure to watch that. Home health care, we talked about in the last chapter. It's designed to provide care in a patient's home. Services can include the nursing care, personal care, therapy, and homemaking. Health departments, hospitals, private agencies, government agencies, and nonprofit or volunteer groups can offer home care. So when I worked in West Branch and I did home care, it was through the health department. Memorial and McLaren, they both have their own home health care department. Private agency would be like I worked for as an OT in home care. So Alara Caring, or it used to be Great Lakes Caring. And then also the nonprofit or volunteer groups, those are the ones who would be providing the personal care of the homemaking more. So they may offer somebody to go into the home and help someone get dinner or get breakfast, to do some housework, or just to keep the person company. And then there's hospice, and it provides care for people who are terminally ill and who usually have a life expectancy of 6 months or less. So have people lived longer than 6 months on hospice? They certainly have. And when the 6 months come out, they do not kick them out of hospice. They do continue in hospice if their prognosis still says they may die in 6 months or less. It can be provided in a person's home or in a hospice facility. Here in Owasso, we have a hospice house and is located on Copus Road. Is a house that they've transformed for hospice patients. And why somebody might go to a hospice house or a hospice facility for hospice or end of life care? Their home may be too small for the equipment that's needed, or they may not have enough people there to care for them. So therefore, they would go to a hospice house or facility. Here in Owasso, for the hospice house, they have volunteers that come in and stay with the patient, and they also have the family members that also put on the schedule so that they come in and stay with the patient also. They can also offer palliative care, or care that provides support and comfort and is directed toward allowing the person to die with dignity. Hospice allows patients to die in the home if that's where they want to be, instead of going into the hospital and passing away there. It's definitely a holistic approach. They have psychological, social, spiritual, and financial counseling for both the patient and the family. And many hospice agencies, they continue with counseling for the family, maybe up to a year after the patient passes away. Hospice is a great agency, a great organization. It's very much needed and important. Sometimes people may join hospice in order to get some of the supplies that they need. So let's say a patient needs a hospital bed and their insurance doesn't cover a hospital bed, or they're unable to afford to rent a hospital bed. Hospice provides a hospital bed, so they could be in hospice just to get the hospital bed. Of course, they still have to meet the criteria for hospice with a prognosis of 6 months or less, or have certain diagnoses that makes them qualify for it. Another thing that hospice provides is incontinence supplies. So incontinence is when a patient is not able to go to the bathroom or make it on time. So essentially they have to use adult diapers, and those can get expensive. So again, if someone needs incontinence supplies and they're not able to afford them, by being in hospice, the hospice provides those incontinence supplies free of charge. So, and also hospice, I don't see it as, I'm coming on hospice, I'm giving up on life. No, it's enjoying those last few months of life as much as you can, and hospice helps patients to do that. There are some of the best nurses. Hospice is able to control pain the best way. So as people continue to progress or degress, then their pain tends to get worse, and hospice does a great job managing pain, which is really important for those patients to be comfortable. Like I said before, it provides support to families following a patient's death also. Here's another great video that tells you more about hospice and explains what it is. Mental health facilities, they treat patients who have mental disorders and diseases. Examples of facilities include guidance and counseling centers, psychiatric clinics and hospitals, chemical abuse treatment centers, and physical abuse centers. So here in Owasso, we have Taylor Life Center, which is on 52, not too far from BG's, and they provide counseling. There's a Geri Psych Ward that is specifically for geriatric patients who are having psychiatric problems. So Owasso Memorial does have a psych unit, and usually those patients are there just for a short term before they can be transferred to a more long-term place if needed. Genetic counseling centers, we talked about some genetic testing in the last chapter. They can be independent or be located in another facility, such as a hospital, clinic, or physician's office. Genetic counselors work with couples or individuals who are pregnant or considering a pregnancy. They perform those prenatal screening tests. They check for genetic abnormalities and birth defects, explain the results of the test, identify medical options when a birth defect is present, and help the individuals cope with the psychological issues caused by genetic disorder. So again, parents need to decide if genetic testing is something that they would be interested in. Maybe they want to prepare better for when the baby is born, so it's not a shock. So again, this is a choice that parents need to make together. Examples of genetic disorders are Down syndrome, cystic fibrosis are a couple of them. Counselors also frequently consult with couples before a pregnancy if the woman is in her late childbearing years, has a family history of genetic disease, or a specific race or nationality with a high risk of genetic disease. The older a woman is when she's pregnant, the higher risk she is, and the higher chance of something, I don't want to say go wrong, because any baby that's born is wonderful, but a greater chance that there could be a genetic abnormality with the child. So as women age and they want to be pregnant, those are things they need to think about. Rehabilitation facilities. These are located in hospitals, clinics, or private centers. They provide care to help patients who have physical or mental disabilities to obtain the maximum self-care and function. They may include physical, occupational, and recreational speech and hearing therapy. So what is recreational therapy? So recreational therapy helps people to do all those fun activities that they enjoy, all those things that people do for fun, whether it's skiing or basketball or swimming or going to the beach or biking. The recreational therapist helps with them. So it doesn't mean that just because you are a paraplegic, you can't ski or play basketball, because you certainly can. They do have wheelchair basketball teams available, and they have special wheelchairs they use. And if you have amputees, if you have an amputation, you can certainly keep running. I have a friend who's a veteran, and he is a below-knee amputee, and the veterans bought him a arm bike, and it's a pretty sweet ride, let me tell you. I even tried it out. It's custom made for him, and he uses his arms to cycle, and as a result, he's traveled around and does some marathons with this arm bike that he got. So recreational therapists, when I worked at Mary Free Bed, there's going to be a video on Mary Free Bed, which is a rehab hospital. The recreational therapist, we took a client who was a paraplegic and also a below-knee, bilateral below-knee amputee, and we took her grocery shopping. The recreational therapist would also take clients or patients to restaurants. It's different going to the restaurant for the first time in a wheelchair, pulling up to the table. The table might be too low and they won't be able to fit the wheelchair under there. Or it also helps with patients getting used to people staring at them, because unfortunately people stare at those who are considered different, whether they're in a wheelchair or may not be able to use a certain limb. So it helps them to get used to going out in public, maybe with their new disabilities that they have. So like I said, here is a video on Mary Free Bed Hospital. It's a rehab hospital. So if you were at Mary Free Bed and you needed surgery, you would essentially be discharged from Mary Free Bed, go to another hospital for surgery, and then return back to Mary Free Bed. This is definitely a sales pitch video. They're trying to get people to come, but it does show you what Mary Free Bed provides for patients. It also talks about in there how patients have to have 3 hours of therapy per day or 15 hours per week. That is a criteria for going into a inpatient rehab program, is the patient does have to tolerate 3 hours of therapy in a day, and it could be PT, OT, recreational speech. It's a combination of all of those. If they're not able to tolerate that due to being too weak or too tired, then insurance won't cover for them to go to a rehab facility. So that is one of the qualifications there. Health maintenance organizations, they are both healthcare delivery systems and a type of health insurance. They provide total healthcare services that are primarily directed toward preventative healthcare for a fee that is usually fixed and prepaid. Services can include examinations, basic medical services, health education, hospitalization, or rehab services as needed. HMOs, some are operated by large industries or corporations, some are operated by private agencies, and they often use the services of other healthcare facilities, including medical and dental offices, hospitals, rehab centers, home health care agencies, clinics, and laboratories. And in the next lesson, we talk about HMOs even further as a health insurance. Industrial healthcare centers. They have occupational health clinics. They are found in large companies or industries. They can provide healthcare for employees of the industry or business by performing basic examinations, teaching accident prevention and safety, and providing emergency care. I know for Daimler Chrysler, they used to have an OT that worked there, and would look at their the ergo to make sure people were using good body mechanics on the job. When you use good body mechanics, you're less likely to have an injury. And also, if someone needed OT that worked there, they could go to the OT. So large companies may also have a medical clinic there in which, like it says in there, their employee could go there if they become sick while they're on the job. Major resort industries such as Disney may also provide emergency health care to visitors who are visiting the resorts. School health services, they are found in schools and colleges. For colleges, it's nice that while you're at college, if you get sick, you're able to go to the school health service rather than finding a new doctor in the area. They can provide emergency care for victims of accidents and sudden illness. They perform tests to check for health conditions such as speech, vision, and hearing problems. Here in Shiawassee County, when kids are in elementary school, they have hearing testing and vision testing, and it's actually our health department who does that here in Shiawassee County. They also promote health education. They maintain a safe and sanitary school environment for all the teachers and for the students. And they may also provide counseling to students as needed. Pharmaceutical services are, of course, pharmacies, chemists, or drugstores. The pharmacists prepare and dispense medications and provide expertise on drug therapy. And they ensure patient safety through education. So they would educate their patients on their medications and on their side effects. They can be found in many settings, including hospitals, community stores, clinics, nursing homes, and even online. They offer over-the-counter drugs, vitamins, and herbal medicine remedies. So over-the-counter drugs are, of course, those are ones that you do not need a prescription for. And if you may go to the pharmacist and give him your symptoms, and he may be able to recommend an over-the-counter medication that would work for you. So you can start working in Chapter 2, the questions 1 through 10. The workbook questions will all be due the day of the test, which will be sometime next week, probably on Thursday. And you can also read the chapter, of course. So government agencies of health services are offered at the international, national, state, and local levels. Their government services are tax supported, and these are all government agencies, and they just look like a bunch of letters, which they are, and we'll be talking about each one individually. So WHO, the World Health Organization, again, we talked about that a little bit with the last chapter and with pandemics. They're an international agency that is sponsored by the United Nations. They compile information, investigate, and address serious health problems throughout the world. The main objective is the attainment by all people of the highest possible level of health care. And their website is at www.who.int. Again, here's a video just to tell you more about the World Health Organization and what it does and how it works. The U.S. Department of Health and Human Services, or the USDHHS, it's a mouthful either way. It's a national agency that deals with the health problems in the U.S. The goal is to protect the health of all Americans, especially those who are in need. And they provide the most grant money than any other federal agency. And again, they can be found at www.hhs.gov for more information. The National Institute of Health is a division of the USDHHS, and they are involved in researching disease and conducting scientific studies. So why is it important to research disease and conduct scientific studies? So there's a few reasons. Once you research the disease, you learn more about it, and the more you can learn about it, the more you can treat it or maybe prevent it. They also, as they research it, they may find a better treatment for it, or they may cure it, or stop it, or find more ways to prevent it. So it's important that this research is done. And they can be found at www.nih.gov for more information. The Centers for Disease Control and Prevention is another division of USD HHS. It is concerned with the cause, spread, and control of diseases and populations. So, the CDC is a U.S. division. So is it only in the U.S. that the CDC works, or is it a global? Is it all over the world? It can be found at www.cdc.gov. Here's another video that talks about the CDC and what it does, and you'll find your answer as to whether it's only in the U.S. or if it's a global effect. The Food and Drug Administration is a federal agency responsible for regulating food and drug products sold to the public. It protects the public by regulating things such as medical devices, cosmetics, and cell phones. And they are found at www.fda.gov. So the FDA are the ones who approve new medicines, new medications. They also approve of what is able to go into our food, what is able to go into our cosmetics. So something that we talked about in class is just because the FDA approves it, is it always safe? Has the FDA recalled different medications or different products because they have later found out that they cause cancer? Or is cancer or in other diseases on the rise? Is this maybe be due to everything that is now put into our foods and our cosmetics? Questions to ask, questions to think about. I know when I was younger, I can think of about one person when I was younger who had cancer, and now I'm sure you can think of 5 or more. And so why is that the case? Is it because we're living longer? Is it because there's more stuff just in our environment? Or is it because of all the chemicals and all the products that are put into our foods and into our cosmetics that we use? When your great-grandparents were younger, they probably ate, they made their own food most of the time. They didn't head to McDonald's to eat. They probably had their own garden, so they grew their own fruits and vegetables, and usually they would can food so that they would have it all winter long. Deodorant wasn't such a big issue. Maybe it wasn't used quite as much as we use now. So go ahead and look at some of your products that are in your cosmetics, such as deodorant has aluminum in it, and according to the FDA, aluminum is safe in small doses. So something to think about in deodorant: are you using over a lifetime? Are you using a small amount, or are you using a pretty big amount? All things to think about when you look at different things that you may be using. And is it just because of everything that's put in our food? It may not be. It may be just stuff that's in our environment. It may be that we're living longer. It's probably a wide variety of things. So I'm not telling you not to use deodorant or eat food. I'm just telling you to look some things up and research it. The Agency for Healthcare Research and Quality is a federal agency. We talked on this quickly last time. Again, it's established to improve the quality, safety, efficiency, and effectiveness of healthcare of Americans. It can be found at www.ahrq.gov for more information. The Occupational Safety and Health Administration, otherwise known as OSHA, it establishes and enforces standards that protect workers from job-related injuries and illnesses. It issues standards on things such as limits on chemical and radiation exposure and use of personal protective equipment. They can be found at OSHA.gov. They go into workplaces and they check to see if the workplace is safe. If water is spilt on the floor, is it picked up quickly or is it left on the floor for somebody to slip and fall? OSHA can be for all different companies. It can be from construction to the medical field. So OSHA, an OSHA violation in the construction field where you got those big dump trucks that dump well, you can't put a ladder in there and then raise it up so you can get up higher. That would be an OSHA violation. Any spray bottle cleaners that are out, they need to be completely labeled as to and identified as to what's in there. If spray bottles are not identified, again, it's an OSHA violation. Here's a list of the 2018 top most frequently cited violations. The key tag there with the black box and the red tag. If equipment is broken or if it's not safe to use, it's supposed to be locked so that it cannot be used. If there's not a lock on it, then again, it would be an OSHA violation. Are people using the correct personal protective equipment on the job? Are they safe? Are they slipping and falling? Are they using forklifts properly? So the OSHA is the ones to make sure that the workplace is safety. Some workplaces may have it listed injury-free for 118 days, and that's really exciting and important for those workplaces to have that. The Office of the National Coordinator for the Health Information Technology. It leads national efforts to build a private and secure nationwide health information exchange. The goal is to improve healthcare by allowing health information to be exchanged quickly among providers. And they can be found at healthit.gov, healthit.gov. They're the ones to make sure that our information that is on computers is safe and protective and that anybody and everybody could access to it. Health departments. They provide health services as directed by the USDHHS. They provide specific services needed by the state or local community. Immunizations for disease control, inspections for environmental health and sanitation. So it's the health department that will check out restaurants, make sure restaurants are safe, make sure there's no mice there or that people in the restaurant aren't using the meat knife on lettuce, to make sure that the refrigerators are at the right temperature, to make sure that items in the refrigerator are where they're supposed to be. Communicable disease control. I think I said earlier in this lesson, the health department is who we go to regarding COVID. They collect the stats and records related to health. They also provide health education for their public. And they can also provide clinics for healthcare and prevention, and it can be found at hhs.gov. So with all the private healthcare facilities that we talked about today, what do you think would be most interesting to work at and why? So that's the end of lesson 2. If you have any questions, be sure to contact me and have a great day.